Hi, welcome to You and Your Health. I'm your host, Dr. David Bertone. Today's show is part 2 of a series that we had on concussions in youth sports. In our previous show, we talked about the mechanics of concussion and what kids can expect after the concussion occurs. In today's show, we're going to break it into 2 parts and speak about the cognitive or the thinking aspects after the child sustains a sports-related concussion, and also speak with a parent that has a child going through concussion rehabilitation at this time. Our first guest is Dr. Joseph Conroy. Dr. Conroy is dual board certified neuropsychologist. He has a practice in Monmouth Beach, coastal neuropsychology. Dr. Conroy, welcome to the show.
Thanks for inviting me.
We just want to review briefly what a concussion is for the audience.
Sure.
A brief overview.
Concussion essentially is, there are 2 components to a concussion. There's what we refer to as kind of the physiologic component to it. And what that really is after a traumatic brain injury, there are damage to the cells, and basically it's a metabolic issue in the brain. And there are issues related to blood flow and neurochemicals and things like that. But without getting into all the terminology, essentially what we're really looking at is a brain dysfunction as a result of a mild traumatic brain injury.
Okay. And then we know that there's millions of kids that are sustaining these sports-related concussions. When you see them for the first time, what is the psychological aspects that you typically see in these, what you're saying is post-traumatic head injuries or mild brain injuries? What are the typical signs that some of the kids are still dealing with?
I think it depends where they are in the recovery curve. But for kids who have, it's been maybe a couple of days later, their pediatricians want me to take a look. Often when those kids come in the office, they're still having problems with being very reactive to lights and sounds and just, the ambient environment. They may still have dizziness. They're likely going to still have headache. Typically, they're not back in the school setting, and they may have, for lack of a better term, some brain fog. They'll have issues with attention and concentration and processing speed, things like that.
Now, will you typically see them pretty early on in the process, or is there, they start having some symptoms, and then you may see them after a couple of weeks after they've seen their pediatrician or some other specialist? Do you typically see them early on in their process?
I don't. I mean, there's some pediatricians who just feel more comfortable having somebody who does, concussions a lot. But typically, the population of kids that I see, unfortunately, are the kids who aren't hitting the reset button right away. They have more protracted recovery curves. They're still out of school. Maybe the idea of kind of cocooning and shutting them down, we're not getting the response we'd like. So I see a lot of student athletes like that.
Well, you mentioned cocooning. Let's talk about that for the audience. It's a common treatment approach now, where we give the brain a chance to really relax and start healing. Can you explain that process?
Sure. The idea is, we know physiologically when the brain's been concussed, we just need to give it an opportunity to heal. And one of the things that happens in the brain is there's decreased blood flow. And anything that goes on for the child that increases blood flow can make them more symptomatic. And actually, there's some thoughts that can even delay recovery. So anything aerobic, even studying, reading, computer work, Xbox, any of those kinds of things, the kids are going to feel worse. So the idea behind this is, as best we can, shut them down from a lot of stimulation, keep them quiet, keep them out of school, nothing aerobic, no computer work, no computer games, not really wrap them in bubble wrap, but pretty close.
Now, these are the kids that are really beyond the normal recovery phase. I mean, most kids we know recover within 7 days of a mild concussion. But now you're talking about lingering symptoms. And is that where you want to really focus that time in the healing phase, or do you do it early on?
I do it early on because I think there's some evidence that the better we do that, the more likely we're going to hit the reset button a little faster. I think one of the things that often happens is, I'll give you an example. We may have a child who has a concussion on a Friday. On Sunday, they kind of feel okay, and they'll go back to school. And by 9:30, they're in the nurse's office. Because just the lights, the sounds, trying to study, being in a classroom, and they shouldn't be back yet. So as a matter of fact, we'll talk about this a little bit. It's, I think, early cocooning, early aggressive management is something that I really advocate. And what we're seeing is for kids who really have more protracted recoveries, at a certain point, cocooning is not going to get us to where we need to go, and we need to shift gears and look at rehabilitation of concussion in a very different way.
Now, these are the kids that you and I are starting to see when we treat them, that maybe the cocooning is being protracted and they start getting deconditioned and all the other psychological aspects of just shutting down. Let's talk about some of the neuropsychological testing that you might do. I mean, obviously it's something that people can't see. You can't see the broken leg, you know, there's no swelling. Where does the neuropsychological testing come into play here?
Well, a lot of schools, physical therapists, a variety of other people will use kind of neurocognitive screenings, computer-based neurocognitive screenings to get baselines. And that can be of value because there's one universal among most athletes, which is when they come in and they want to go back and play. They have no problem looking you right in the eye and lying and telling you they feel fine. So by looking at neurocognitive functioning, things like memory, reaction time, cognitive processing speed, that can give us a little more sense of whether they truly have hit the reset button, and then we can kind of look at more, a graded exertion protocol and getting them kind of moving back into sports and into the school setting.
Now you're talking there in which you have like a baseline before injury or something like that. Now what happens if you don't have that baseline? Because we're doing a little bit more of this baseline testing, which is really essential to establish that healthy state of the brain and their balance and all the other things associated with it. But what can you do after from a testing standpoint if you don't have that information beforehand?
After, I mean, we are often making our best guess as to what that child's neurocognitive status was prior to the concussion. So one of the things I'm going to look at, what was going on with grades? Generally, how were they as students? One of the things that really makes this complex is we'll have kids who maybe they have a pre-concussion diagnosis of attention deficit hyperactivity disorder or a specific learning disability. And that, one, it puts them more at risk for protracted recovery. And the other thing, it makes judging their cognitive status afterwards a little more challenging. But we do our best to infer some of that. And for kids who really have protracted recoveries, we're really not just doing those neurocognitive screenings, but we're doing a more in-depth neurocognitive assessment to help put together some planning for school.
In terms of the treatment approach for this, so they have some cognitive impairments. We're talking about impaired memory, slow processing, really difficulty focusing in school. What are some of the treatment approaches for those kids?
Early on, a lot of it from a treatment approach is accommodative. This balancing act, often we have students who are really not well enough to be in school. They may be on home instruction. And one of those things, really want to get them back in the school setting as quickly as we can. But a school setting without accommodations won't work. So I think you mentioned it. One of the things that's really challenging is these kids may look fine. So one of the things we're often doing, we'll do things like, guidance counselors always love me when I tell it's okay for kids to wear sunglasses and a baseball cap in school for some of the visual things. But it might be something as simple as that. It might be things like getting copies of notes, not having the demand of sustained attention in the classroom. You're going to get copies of teacher student notes. We might, often kids who have visual issues post-concussion will have real problems with reading. So we'll get them audiobooks. So there are a variety of things based on individual, child-student presentation, and we'll modify based on exactly what their neurocognitive strengths and weaknesses are.
Now, do you see in your office any other things that might occur with these kids? Are they having depression or other issues that might be manifested because of the head injury? And do you treat those with some type of therapy?
We do, and they can fall into a couple of categories. One is, and people don't often think about this, but post-concussion, associated with post-concussion, can be mood disturbance. You'll get kids who have never been depressed or anxious before, and now they are. They're a little more agitated, they're a little more tearful, they have more lability of mood. The other part is for those kids where sports is a big part of their life and their identity has been that they're an athlete. Well, now they're very disconnected. They're not at practice, they're not playing, and if they're out long enough, for some kids, especially with a long concussion history, maybe this is concussion number 4 or 5, and we're really having a discussion about whether they're going to go back and play, then we do see some kind of reactive depression to that, and those kids typically are going to be very good candidates for individual and family therapy to help them cope with that loss.
Now, in terms of any other treatments that you might do in the office, just with say, the memory, instead of just the accommodations? Is there like computer-based models, or is it more just counseling? How do you work on some of those things?
For those kids where we have protracted recoveries, once again, it depends on history, but for kids where it looks like this is going to be long-standing cognitive issues, we will do some directed cognitive rehabilitation. And the great thing is we have technology now, so they don't have to be in the office doing it all the time. A lot of this some of it is paper pencil, but these days they can use game systems for it. A lot of apps on iPads and other tablets are great for things like attention, working memory, reaction time, processing speed. And as long as kids are motivated, they can do those things on their own outside of the office as well.
Great, great. I know we've been working together on some patients, and we're finding that, you know, the physical activity part and the aerobic activity and the exercise is really helping with the retraining and restarting their system. Have you noticed that with any of these clients that go through that type of program?
We have, and I think it's one of those kind of discussion about mind-body. I mean, I typically see when you're working with some of these guys and you get them moving and they're getting more aerobic work and doing more work on balance and strength, they'll come back in and they'll look better cognitively. So I think we're seeing an evolution in concussion management with some of the work that you're doing on some of the aggressive, balance and aerobic work, where, it's not that long ago that the plan was just keep them shut down and let's hopefully at some point they're going to hit the reset button. And I think we're learning that there's a diminishing point of return with that philosophy.
Yeah, and I think that's only recent. We're talking only the past 2 or 3 years.
I agree.
Prior to that, they were just shutting them down until the symptoms went away.
Exactly.
And the symptoms just weren't
Sometimes
going away.
Right.
Let's talk about some of the specific return to school accommodations. I know you mentioned, the different reducing the day or wearing sunglasses or things like that. How specific are you getting with some of the schools in terms of the number of hours or incorporating homeschooling or test modifications or things like that?
I think we have to get very specific, and hopefully over time with increased education we're going to see guidance counselors and other school personnel get up to speed, but often they're really overwhelmed. When students like this present, they don't know what to do with them, and typically they're pretty receptive to recommendations that are made about just those things. Do we need to have, when we go back in, this combination of home instruction first, then blending home instruction and some experiences in the classroom, and then when kids do go back into the classroom, we often modify testing, we'll modify, it's very student specific, but we get pretty detailed in the recommendations. The whole idea is to, we have to find a way to make that educational setting appropriate.
And they're receptive to that, I'm assuming. Most of the schools are receptive to that. They're just looking for the guidance and the help because they're just not used to dealing with this.
Right, and I think, as we said, it often looks like an invisible impairment. And so part of that role, I think, that we both have is to, give them some education and get them up to speed on exactly what some of the impairments are that these kids have. But they do need some guidance and sometimes a little hand-holding to figure out exactly what kind of accommodations are going to be necessary so that that child, the whole idea, we want them back. As soon as we can, we want to get them back into that school setting. That's where they belong. But often to be able to do that, you really have to build a safety net.
And we're dealing with symptoms here. We're dealing with things like dizziness or headache, and we need to be able to monitor that. We don't smother them. We don't say, how do you feel, how do you feel, how do you feel every 2 seconds. But we need some way of monitoring that. One of the things we do is these graded checklists. We ask them how they're feeling, and they put a score on it. And do you find something like that effective and helps you with quantifying where they're at in terms of their symptoms?
I do, and I joked before about athletes and student athletes maybe not being totally honest, but I think one of the things that happens is part of my role when they come to see me. There's an educational part for them as well, and I find that after we spend a little time with them, students get it, and at that point, they're very straightforward about their symptoms. And you know what? I need to hear from them, not from their parents. In terms of how they're doing. And I think that the way we approach this, we make them, you and I have had this discussion about how we put together a treatment team. Well, the student themselves, they're always part of the treatment team. They need to have an active role in their own management and treatment.
So you just heard from Dr. Joseph Conroy. When we come back, we're going to speak with a parent, Ann Losch, about her dealings with post-concussion syndrome.
You could choose to join a gang. You could try the latest drugs. You could even choose to drop out of school. You can try to avoid the difficulties in life with a quick fix, or you can face them head on. She did. Make the right choices today and be ready for the challenges tomorrow. This message is brought to you by the U.S. Air Force.
Welcome back to You and Your Health. I'm your host, Dr. David Bertone. In our first half, we spoke with Dr. Conroy about all the different cognitive aspects of post-concussion syndrome. Now we're going to speak with Ann Losch. Ms. Losch is a parent of a student athlete who sustained a mild traumatic brain injury and has been currently dealing with post-concussion symptoms and rehabilitation for an extended period of time now. Mrs. Losch, thanks for joining us.
Hi, thank you.
Can you tell us a little bit about what happened in Rebecca's case?
Beck was injured playing lacrosse last spring. It was April 24th, and she was hit in the back of the head with a ball during the warm-up drill.
Okay. So it was a relatively benign injury at that point. Didn't seem anything that serious.
Well, she fell down and she got back up and continued on.
Okay.
So she remained on the field, and we were not aware that she was hit until after the game when she told us. But she told us she got hit in the head. We had her checked out. She seemed okay.
Now with lacrosse, you said?
Lacrosse.
Yeah, so there's no helmets in lacrosse?
Women do not wear helmets.
Okay, so then we're talking about, I mean, most people think about youth sport concussion. It's
Right.
usually the football where there's a helmet involved, or maybe even soccer where head-to-head contact. So in lacrosse, this was a ball.
It was the ball.
Okay.
Yeah, and in lacrosse, often you'll hear about stick-to-head contact during competition. The ball's dense. It's a hard ball. Although it's rubber, it's very dense and obviously can do damage.
Now, talk a little bit about the sequelae. What happened after then with her?
We had Rebecca checked out that night. She was going to physical therapy for another reason anyway. And so we had a set of eyes on her.
Okay.
She seemed fine. She did say she had a headache. We didn't realize that was a big red flag. We should have known what we know now. And over the course of the next couple of days, she went to school. She went to practice, she played in another game, and still, to us, again, you can't see the brain, to us, she appeared to be okay. On Friday, we started to get concerned because she was sleeping a lot. She was complaining of headache. She was just not herself. So Saturday, which is now Tuesday, Wednesday, Thursday, 4 days after her injury, we took her to the pediatrician. We were told she had a concussion.
Okay, and then what were her symptoms there early on? Did she have headache, or
You know what?
dizzy, or?
Not the obvious symptoms that I would have considered for a concussion. It was subtle. Initially, it was very subtle, and we now know that the symptoms can be very subtle, which is part of the problem. She just said she had a headache, but she was making sense. She was doing her schoolwork. She was continuing on about her day. After she was seen by the first doctor, and we were told that she should rest, we did what we thought was rest.
Mm-hmm.
No one explained cocoon therapy for another 2 days. And once we understood about cocoon therapy, we did shut her down. And then there were more obvious symptoms, but mainly fatigue, headache, seeming dazed. A lot of the symptoms that kicked in didn't kick in for probably 3 weeks.
Mm-hmm.
So then the photosensitivity, the noise sensitivity, the just fatigue that you can't even describe. Not just being tired, just not being able to function. So we went on a path of seeing many doctors over many months, and those symptoms were pretty significant for many, many months.
I think it's really critical that you point out that in the beginning it was relatively mild, her symptoms, and it just progressed.
She got worse.
Mm-hmm.
At one, after the cocooning, we were advised that she could go back to school half days. We thought she was fine. Again, all these things that we've read, you can't see the brain. I read all those concussion forms.
Mm-hmm.
I signed all those concussion forms. It's so true because we thought she was okay. She went back to school, and she wasn't okay, just as Dr. Conroy said. She shouldn't have been in school.
Yeah, let's talk to Dr. Conroy about that. Dr. Conroy, was there a situation here where maybe the symptoms weren't severe, that they decided to bring her back to school early, or how might that have been changed based on her symptoms?
You know, I think it's, as we have this discussion, it's easy to see how it was missed. And I think one of the things that happens is the more concussions you see, you realize that you can get very different early presentations. And I think, unfortunately, probably she played in a game, we did some other things, then back into school, and it's almost like a runaway train. The symptoms increase to a point where it's like, now it's, oh my gosh, and you're playing catch up at that point.
So it's unfortunate we're talking retrospective here, but what we're trying to do is educate people about some of the things that we need to do to really make a difference in the kids. So, yeah, I mean, things progressed.
Things progressed, and the things that we thought we were all doing that were beneficial for Rebecca, what we know now, we're not. We thought, okay, you're not playing, but go to the game. Be part of the team. You'll feel better, be on the bus. All those things were terrible to do to a concussed athlete. But she didn't know it. She couldn't tell us that. We didn't know it. And I think that cognitively, she's kind of a stoic kid. So she just was like, okay, I'm back in school, and she was trying to do her work. And that was when things got really bad. So she was then pulled out of school, and that was in May that she left school. Okay,
so talk a little bit. I know you've had some frustration with the system and mainly getting the right answers and the right treatment approach. I think that's a common problem. We have a lot of practitioners that's just not used to treating concussion. Can you talk a little bit about that and how that
I think from a parent's point of view, for her dad and I, where do you go? Do you go to the pediatrician? Do you go to a neurologist? Who do you go to? If you blow out your knee, you go to an orthopedic surgeon. And then you get an MRI, and then you get surgery, and then you rehab. We went everywhere. It's a slippery slope. And until you understand what's actually going on, and everyone's different, and all the symptoms are different, you're really just spinning your wheels trying to figure it out. And so we saw 3 neurologists, physical therapist, no, not a physical therapist till we got to you, chiropractor, acupuncture, neuropsychologist, and we got a lot of different answers. So there wasn't a consistent protocol. People had different opinions about how to handle it. We now have a good team, and we're on the right path, but it took a long time. It took a long time.
Yeah,
and other moms and dads that you sit in offices with have the same story. I mean, you see it, us talking in your waiting room.
Yeah. I think it's important that you point out that this team approach is really the most effective way to treat these kids. And we're becoming more knowledgeable as individual practitioners that we need to work together with specialists like Dr. Conroy and some of our other colleagues to create this team where we're all treating the kids to get them back to where they were. Talk about later on your experiences when things started, you started getting some guidance in the right direction. How did things progress at that point?
In the end of November, we went out to the University of Pittsburgh Medical Center to see Dr. Mickey Collins there. And we got there through Dr. Conroy because Beck just wasn't presenting with the typical, having her symptoms resolved. She was plateauing and things weren't getting better. And, thank God we went out there because they picked up on an ocular issue and a vision problem that no one else had picked up on, and we left with a treatment plan. So since then, we're seeing real progress. And I think that's part of the frustration is that there's new research all the time, and not every kid has the same symptoms. So if you don't hit the reset button, if you don't get better in a couple of weeks, and when it goes wrong, it goes really wrong. And you have to keep pushing and asking questions and trying new things. What worked for Rebecca may not work for someone else. But when you have symptoms that just won't quit, there's got to be an answer. So her treatment now, she's making progress.
And you went to the University of Pittsburgh, and let's talk about that program. There's a real specialized concussion center there. They have a whole team approach to analyze the kids, not only just kids, but professional athletes. And a lot of people go there. And it's a great resource for even professionals like us. And we're trying to model something in a small community like this to do something similar. What were some of the tests and things that she went through that were able to pick some of that stuff up?
Rebecca was seen by neuropsychologists who did neurological testing. She was seen by exertion specialist, vestibular specialist, vision specialist, and doctors who deal with medicating for concussion symptoms. And then they all got together, talked about the results. There was a lot of testing, hours of testing was done, and came up with a plan. And it was very empowering for Rebecca to have someone say, yeah, this is what's wrong, and this is what you can do, and you're going to get better. Instead of just wait, things will resolve and you'll get better. So to be proactive, especially as an athlete, to be told, go to therapy, and she comes to you, she doesn't feel good doing what she does with you. But it's a process, and she knows that by doing that, she'll get better. So the team approach was huge. It was huge to have all those different specialties.
And I think for you to hear that there's a problem, this was identified, and a treatment was geared to that really makes a big difference. Right. And the problem is sometimes they just shut down and go rest until you feel better, and they're not getting any guidance with the treatment. Then everybody's thinking, well, what's really wrong, and how do we get it better besides just rest? So
yeah, and to be told, well, you should be better. Well, you're not better. So you need more of a plan than that.
Yeah, and the research now, and even some of the war heroes and stuff that have, Dr. Conroy, maybe you can speak a little bit about that, some of the research that's being done about mild traumatic brain injury and how it's being brought into the youth sports leagues and how we're using some of that information.
Well, I think it's exciting. It's a horrible way to get this information, but some of the information we are getting in research has to do with vets who've had multiple, essentially blast injuries. They're being exposed to these IEDs and and they come back and they have these symptoms, and they've had the same experiences where people are saying, you should be better. You should be better. And unfortunately, we're learning more and more about this population of individuals who they have a more protracted recovery curve. But I think as we've talked about this, we're learning that we need to be more aggressive in their management.
Great. Ms. Losch, just talk a little bit about Rebecca's current state and what she's doing, and kind of bring everybody up to speed how well she's doing.
She's really turning corners. How many more corners there are, we don't know, but she sees you 3 times a week for specifically like vestibular and physical therapy, and you do some of the vision therapy with her. She does vision therapy daily at home, which is a computerized program that is monitored by the doctors in Pittsburgh, so they can see her progress and see what she needs to change up, as well as other therapies at home that she does throughout the day. So all different types of visual exercises. Many of her symptoms that just want to quit are a result of this visual issue. And I give the example, you kind of feel like you're in a really bad amusement ride 24/7. If your eyes aren't properly doing what they're supposed to be doing. So she's making progress. She's still not in school. She's still being homeschooled. And we have a great group of teachers who had to learn also. As you said, the guidance department and the teachers don't know what to do. All of her learning is verbal because she does not have the medical clearance yet to read and write. It just exacerbates her symptoms too much. But compared to even a month ago, I think there's huge progress.
So how about some of the social things that she's doing now? Is she back to some activities?
She does whatever she can do. She's an athlete. She goes to the games.
Great.
In the past, even in the fall, she went to the soccer game. She was a soccer player as well. But she needed sunglasses and earplugs to go to the games. Now she doesn't need the earplugs, and she only needs the sunglasses on a really bright day. She goes to school occasionally and will sit in class just to listen. And go to lunch just to be with her friends. So socially, she's at least getting out. I think what people don't understand is the symptoms of concussion are very isolating. The kids try to do stuff, but they just feel too lousy. It's like someone's right here in your face screaming. So yeah, she's doing much, much better.
Great.
Yeah.
Well, thank you for sharing your experience, and Dr. Conroy as well as your expertise. Again, you heard about concussion in youth sports and some of the symptoms and some of the ramifications that occur. Thanks again for joining us. I'm your host, Dr. David Bertone, and you've been watching You and Your Health.